My name is Lorena. I live here in Brazil. I am a doctor and I work with cancer. I was diagnosed in May 2023. I think, like everyone, I thought I could die. When we have cancer, we have no options. And I wanted and I need to be alive because I had two daughters. The only option was to treat and to believe in my medical doctor. My treatment had two phases. The first one with 14 cycles of chemo, and the second one with 4. But the second one was more toxic for bone marrow, and I became anemic during my treatment. I had 7.5 of hemoglobin, and my doctor said, I will do a transfusion, okay? It's not okay for me. But why not? Because I know the benefits and the risks of transfusion. And he said for me, if you are with this hemoglobin next week, I need to do a transfusion. And I said, okay, I will not say no, but give me just 1 week. And I started to do cyanocobalamin at that time. Next week, I have 1 point more of hemoglobin, or 8.5. So my bone marrow was working. I am certain I have iron deficiency. So just to not prescribe iron, high concentrated iron for myself, I asked to another colleague, hematologist, that is very expert in the anemia. And I said, see my exams, please. I am on chemo. I cannot postpone this cycle. I don't want to be transfused. 21 days after, I had 10.9 of hemoglobin. And he said for me, is it yours? Is it not of your sister? I said, no, it's not of my sister. It's mine. And he said, okay, I want to know how to do this. And I said, this is patient blood management. The first thing it's very important is try as much as you can to be informed on how are you going to do your treatment. To change ideas with or other persons who are suffering with the same problem, it's important too. Another thing that is important is to say exactly what you want to your medical doctor. I am a doctor and we know many things about treatments of our patients, but it's important to hear the opinion of our patients too. My sister was with me during this appointment, during all the appointments. She said to me, no, if you need a transfusion, do a transfusion. He's your doctor and he knows what to do. And I said to her, oh yes, he knows what to do, and I very confident with his treatment for me. But patient blood management, who knows? It's me. And she said, you are not afraid to do this? No, I'm not. I'm not afraid. This experience for me was very important for me personally, to talk about empowerment of patients. It is part of our concept of patient blood management, but sometimes we forget to inform. You are going to do chemo. What's chemo? You're going to do iron. Why iron? We are going to do transfusion. Why are we are going to do transfusion? And another message, I think it's important for patients to check iron before chemo and correct the deficiencies, because we need our factory of blood, our bone marrow, working very well to our patients, or us as patients, to our better outcome. There is no normal anemia. It's important. It's always saying us that something is not well, something's wrong, and we need to investigate it. We need to see this as a public health problem.